much. Now we move on to our last case by Dr. Dilip Lalwani, and he will be presenting on lens-induced glaucoma.
Thanks, Scientific Committee and All India Society. So, lens-induced glaucoma. My case is 70-year male presenting with intense pain and sudden diminution of vision with high IOP and mild medically hypertensive, diabetic and heart disease. And when we see in the slit lamp, it has mild congestion with corneal microcystic edema with shiny deposits, and fat like capsule is there. And when we do V scan to confirm that diagnosis is there, so we found that hyper-reflective echoes in the V scan reports. And so we did here provisional diagnosis phacolytic glaucoma and started medically management with the mannitol. And after controlling the mannitol and topical beta blockers and steroid, we started and we diagnosed that this is a etiogenosis of this lens, so better to remove lens. And we planned a phaco surgery with IOL implantation, and by dyeing the blue rax capsule, we did a perform capsulotomy. And here lens is a main role of etiogenosis in this phacolytic glaucoma. So gradually we emulsify the lens and implanted a IOL. And one of the main thing is that appearance of this case is very early, 1 or 2 days. So it will depend if you plan only cataract or cataract with the trap surgery or any other angle surgery. So after performing the lens implantation, usually this is a 3-piece implantation of the IOL. So if any case is presenting with the 7 days or 10 days period, then definitely you will find a synechies or so. Here after the performing surgery, I will do some lens visualization whether there is an angle blood there is or any lens pigments, lens protein is deposits or not, or any fibrosis is not. There is not any fibrosis or synechies. So we after performing this surgery, post-operative results are good, and some slight post-operative edema is there, and IOP is in the 15 or 16. So here we can take home messages that it is a triad of acute pain, congestion and high IOP. So we have to see this type of cases, and common cause of this ecomorphic phacolytic is very rare. So general awareness to the patient, doctors should be there, and patient is also aware that once you feel pain or high IOP or sudden intense red eye, then it is you should come first. So public awareness and early detection is important, and early cataract surgery aids in visual recovery and IOP control. Thank you.
Thank you, Dr. Dilip.
A spatula I am using for last one, sir. Dialect, some side of dialect. Circular, half circular. That time it is very important to lift the lens
and you said a very nice point about doing the gonioscopy at the end of the surgery to decide whether any further management for the angle is required or not. Because it depends on the duration of how long the lens-induced glaucoma had been sitting. If it is more than 7 days, it's more likely that it has converted to a synechial angle.
Now currently I think most of the people wait and see how things
That's agree. I agree.
Is it actually necessary kind of to do any transfer also?
You can. But if you are, since we now have the availability in more OTs of Swan and Jacob than
Yeah,
before,
but
it's a good opportunity to use it and see if it is.
No, how is it going to change your management? If you find signing fee or you don't find signing fee?
You can decide to do a cafe contract.
At that moment, sir, it's directly the
Wants to do GSM, wants to do gonio centralized at the same.
That probably can be not a trap.
Yeah, grab because you have to do it before.
Other thing is Pico Lightix rarely gets signing fees. Pico Morphics
Yeah, it's only
will
fair.
signing it. It's a continuum with the chronic angle course situation.
But sir, if in these circumstances, if you remove the lens and you find the signing here also, that inflate in that condition, perhaps better
Better to play second try.
what you are decent turning is going to entangle in another 6
It
hours.
depends on the kind of population you are dealing with. If it's somebody who's come from the periphery and is here only for this surgery and not going to come back to you, your approach will be different.
Alright, if you are that suspicious, then you better do a trap.
Yeah.
Legal line is not
Better.
better.
I mean, if it doesn't filter in the immediate time, it will just fail. No harm done.
What do you say, Doctor?
For a phakomorphic glaucoma, I think the other line should go here. Like, the patient presence.
Yeah, and do a gonioscopy and take a shot.
Like, if they are usually the other line is okay. Like,
That's very nice.
Once again, going back to a old publication from AIOC,
yeah.
the highest risk factor for both phagomorphic and phagocytic then with other eye being swollen. If one eye has got good vision, second eye is kept till it becomes a problem. And it's still true. Phagocytic and phagomorphic that we see, the other eye is swollen.
But if that other eye is faking, then you have to really watch that.
Get it out fast. Encourage the fellow to get it out fast.
I think the next session people have come to get us out fast. Thank you so
I
much.
request all of